Board of Health meeting, September 18, 2023.
Called the meeting to order at 7:39 p.m.
Okay.
All
And
right.
so, Ava, I don't know if you had, I know you're stuck at work. I don't know if you have an agenda in front of you or not.
I do. Okay, so does everybody have the minutes from last time to review, and is there any comments or changes that need to be made?
None. I would make a motion to accept the minutes.
I'll second.
Okay, all in favor?
Aye.
Aye. Aye. Okay. And then so we'll start with Sands, your report.
Sure. So again, since the last meeting, the summer has been filled with lots of vacations of staff and other things like that. And so we kind of a lot of the summer we do strive to just keep up our basic functions, the water sampling for the beaches and restaurant inspections and stuff, because a lot of the staff are going away on vacations. That was a typical summer for us this year. What Santina and I spent a lot of our available time is working on the 5 grant applications that we submitted this summer. And so I think we've shared in the past, there's a few additional grants coming from the state, an immunization grant, which we applied for, a workforce development grant, which we are in the process of applying for, the preparedness grant, which we've submitted our documentation for, the preventative health block grant, which we submitted an application for, and the per capita grant, I think, is the one I didn't mention, that we have submitted all the information to the state, and we're waiting to hear back from them on that one. So that's been really a lot of, they've changed some of the procedures on those trying to make it a little easier, but it's all new to us, so it takes a little bit longer. But one of the I don't want to say sad, but a little sad, is that we did apply for this preventative health block grant. This is the one that we were asked to present at the semi-annual meeting for the commissioner on, how we've been using the money and how she was impressed with it. Well, turns out we did not get awarded this first year, so we were a little bit discouraged by that. But we will look at what. I'm sure we'll hear soon what applications were approved and the types of programs, and we'll talk with the staff of TPH to see how we can have, a more successful application for next year, because we would like to continue the work of, really what's been focused on bicycle and pedestrian safety improvements and active living improvements. So we continue to work on those grants as the state sends us information. We have to reply back to that. There's a couple of different steps in that of this back and forth of the new state systems that we have to use. But we continue to work on those grants, and so that'll bring us in. If we're awarded most of them, we'll probably end up with over $500,000 in grants for the next. They're varying times. Some of them are 2-year grants, but we are looking forward to that. We are ramping up for our vaccination season, and so Santina and our public health nurse Julie and Jill have been working on setting up clinic dates, and so we will be. We've had a little bit of a glitch with our vaccine delivery. There's been some delays with certain products and certain quantities of order, so we don't have a great gigantic supply of vaccine that we typically have around this time of year or this month. And they've been saying there's going to be some delays in receiving it, so we're going to start out with some smaller clinics, not do our typical large scale come one, come all to the senior center clinics. We're going to start with some smaller clinics, and we'll have to watch our supply so we don't don't have people show up that we can't service. And so we will continue that. We did apply for what's called the Bridges program this year, which is a program from the CDC through the state, which allows us to offer continue to offer free COVID shots for those without insurance. So that'll be an additional bonus thing that we can add. So we'll be planning some COVID clinics once they approve the new vaccine. We will order some of that and start delivering that, both ordering it for those with insurance and ordering it through the Bridges program for those who are uninsured. In the same way that we get, COVID vaccine, flu vaccine through the state for uninsured people under 18, Bridges will allow for all ages. So we'll continue to work on that, and so we'll be announcing some dates shortly on the clinics. So I think we're going to say, Tina said we're starting as early as next week, right?
That's correct. Yep, 10 to 2.
So we'll do some smaller clinics out of our offices, and then the immunization grant. Hopefully, we will hear on that shortly, and that'll enable us to hire an additional part-time public health nurse and additional community health worker to expand our options for offering COVID and flu vaccinations. And in addition, the Senior Center actually received a grant to promote vaccination among seniors. So we'll be working with the Senior Center to meet the criteria of that grant and work with them. And so we're happy to partner with them, and we always partner with them for years now. So we're looking forward to a good season and hopefully going to be delivering some more vaccinations both to seniors at the Senior Center and to those who are homebound and different locations throughout town. We're going to be going out to those locations to senior housing and the like. So we're excited about that grant. And then, as I mentioned, we continued our summer beach water sampling. There was no surprising results. We did have a few closures, predominantly due to rainfall, and a few. So the protocols call for, if you have you collect a bunch of samples and you have a single sample here or there that's elevated, you resample. And so we had a couple of those where we resample at single sites, and in those cases the samples came back, at acceptable levels. And so nothing surprising, but what we're also going to be doing, we started last week, and we will continue next month doing what's called a sanitary survey, where we will be collecting water samples. Last week we did water samples at Southport Harbor, looking at some point source types of entries into the harbor, some pipes that had flows to them, and streams, and sort of tidal water bodies that kind of go in and go out that are in an area of town where there's some dwellings and structures with septic systems. So we're kind of looking to see if there's any problems contributing to water quality issues, and always trying to improve the water quality in town. So that we started that, and then in addition to that, we'll probably go back and do some sampling and some looking. The tides didn't work out for them to go by boat, so we're going to have one of the sanitarians go by boat with the conservation department. We're working with the conservation department on this one, to go by boat up the harbor and look for any pipes or outlets or odd flows that are coming out from residences or structures down in the Southport Harbor, and so we'll sample those. And then in addition, the sanitary survey will have the staff basically walking the entire shore of town at low tide and looking for any kind of irregular or atypical flows, and we'll be collecting samples from those with the hope of eliminating any kind of inappropriate connections to sewer systems or septic systems. But that's just the protocol for the sanitary surveys. Walk the shoreline, and so that's what we'll be doing, looking for any of those types of issues. we did have, and I'll start this and I'll transition it to Santina's report, and I'll let her finish this. We did have, just before I went out for my surgery, we were notified by the state of a few cases of Legionella in Fairfield related to an assisted living facility. So we started working with the DPH on that and the facility on the response, and I'll end my report there and let Santina pick up on, since I was out, Santina took the lead on, Santina and Rob Guerrero took the lead on following up and working with DPH and the facility in the overall response to these cases. And so I'll end it there. If anybody has questions about my portion of the report, feel free to ask.
Yeah, Sam, sorry, you're a little crackly during the grant piece. The one that wasn't approved, was there feedback as to why? Was it just kind of need-based, or was there something about the application? That's something to kind of help in the future?
We haven't received it, not that I'm aware. Again, I've been out for a week now. I've been checking my emails, but I haven't seen anything or talked to anybody about why we got turned down. Santina, you haven't heard anything, right?
I have not, no.
No, so we're not sure, but that's the plan is, to reach out and sort of assess, okay, what was the deficiencies of our application and what do we need to do better next year to be awarded this? Because, we've received this funding for, I think, as long as I've been with the department, and, it's a surprise. It was a surprise to us when we were held up as a model program by the department just last spring. And so we're kind of surprised, but this happens, and so we're going to be reaching out, but we don't have any definitive. They just said thank you for your application. We received a lot of great applications, and unfortunately we did not award yours. And that was sort of a nice short letter. Yeah.
Okay.
Unless there's any other questions, I'll let Santina follow up with the Legionella cases and her report.
Yep. So as Sam's mentioned, we had a few cases of Legionella at an assisted living facility.
What did you call it?
It's called Legionella.
And what?
So it's a bacteria that's found, it could be found like in pipes or like HVAC systems, and it releases into like a mist. So you can't get it person to person, but you can like breathe in the mist and the particles, and it can, that's how you get infected.
Okay.
So we've had a few cases. I've learned a lot about plumbing and HVAC systems and cooling systems. DPH has really taken the lead on the cases, and we've consulted with the CDC. The town emergency management has been notified. The facility has been, doing everything that they can. They've hired a water consultant. They think that they've found the source. So it seems to be coming from the cooling tower of the facility. And they've disinfected it at this point. We've been told that once it's disinfected, it works within minutes and things are, back to being good. They think they've identified the source of the problem, so they fixed that. They've taken water samples throughout the facility, 23 samples from different locations, and we're waiting for the results of that to come back. Unfortunately, it takes about 10 to 14 days to come back, and they did this on last Wednesday. And on Friday, they did a complete deep clean of the system, just in case anything else lingering. So they are taking it really seriously. We've just kind of been there as, whatever we can do to support the state and the facility. But so far, knock on wood, everything seems to be okay.
How does the facility keep the residents safe in the meantime, and were any of the cases fatal?
Not that we're aware of yet. They did lead to some hospitalizations, but from what we're hearing, people are doing well.
Good.
The facility, once they found out, they hired this consultant who really knows what he's doing, and he's consulted with some of the leading experts on, preventative measures. They've put in point-of-use filters, and they've really have done everything that the state has recommended, and the state is making these recommendations based on the conversation we've had with the CDC, and the facility has not blinked an eye. So they're really trying to stay on top of this as best as they can.
And Santina, I would just add to that, like as soon as the facility was made aware of this, they went to provided water, not using the drinking water from the facility, and they use those point of use filters for bathing purposes and stuff that captures it. So that the facility actually had a Legionella prevention program in place. They had sampled in July, and the samples came back negative for Legionella. So it's the type of thing that it does pop up every now and then in systems, and they have a system to catch it. And in this case, the samples they took came back negative, but they did unfortunately have a few cases, and so but they've done everything they can at this point.
Yeah.
I'm just curious. I mean, more from my own knowledge, how do they protect them from the HVAC system? Right, it's been so hot they can't shut down the AC. So if that's the source, if it's the cooling tower there, they couldn't shut it down in the meantime. So how did they keep them comfortable or protect them?
So my understanding is that it's not so much coming in from the vents, it's like the mist that's being released from the outside.
Oh, okay.
Okay, so, and it can travel up to about a half mile. So if one of the people is just outside at the wrong place, wrong time kind of situation, is my understanding of how everything happened. This facility, they did shut down the air conditioning to do that deep clean on Friday for about 4 hours. Again, I've learned a lot. So the rooms are all running on a separate system than the common areas. So at least during those 4 hours of time, if residents were in their rooms and they were hot, the common areas were still air conditioned. So, yeah. But they, before they knew the source of the situation, that's when they started using the bottled water and things like that. But it seems like so they collected 23 samples. The cooling tower came out positive. So they resampled the cooling tower before they disinfected it. They disinfected it, and then they collected samples again from all those 23 locations.
Wow.
Yeah. But again, they're following all of the recommendations from DPH and CDC, including measures going forward. So they're going to ramp up their testing protocol for a period of time until DPH, says it's okay. I think it's quarterly as routine, and DPH has requested that they do monthly testing until they say so, and the facility agreed. So besides that, I just want to give an update on our anti-bite videos. So those were the 5 videos that we released throughout the summer. We are going to kind of do a relaunch in the fall with Fairfield Cares, just while the kids are back in school and, just to really grab their attention. But again, we had 5 videos. So this total views is of all 5 videos, not just shared on our social media, but Fairfield Cares, and we've asked all of the kids to put in their views. We had 24,683 total views from all of 5 videos. Yeah. 783 likes, 78 total comments, and they were shared 409 times.
Wow.
So really, really successful.
Are those views, you happen to know, are they actual click-in views? Does it track that, or is it when it automatically plays as you scroll through your feed or something? Do you know how that? That seems like a lot proportionate to everything else in there. You know what I mean?
Yeah. I don't actually know. I can go back and look. I know on Facebook and Instagram, when you click on the video, it tells you a 3-second view, how many people and how many people have watched it all the way through.
And those are all the way through views, that 24,000?
For us, it is.
Wow.
So I don't, again, that's not just our social media, so I don't necessarily know how the kids were looking at it. But they were, rather popular. So I think it'll be good to kind of revamp it. And speaking of Fairfield Cares, we partnered with them to host the 6th annual overdose International Overdose Awareness Vigil, which was held on August 31st, and we had a really, really good turnout. I'd say we had about 100 people there. So that was really good. QPR, so again, this is the suicide risk prevention program that we have been offering. So I think last time we gave you an update, we were in the middle of doing all of the firefighters. We've completed that. So between the health department and firefighters, we've trained 97 people so far.
Wow.
And then just kind of switching back to COVID, to give an update from Jill. She just wanted me to mention that they've had 34 student cases since the beginning of the year. We are still reaching out to people who test positive, but again, I think a lot of people are testing at home, especially with Mill Plain closing down. A lot of people are not getting, tested with the lab results. So we are reaching out, though, to anyone who is, and again, still providing the recommendations and the guidance. We've worked on one non-school related outbreak in the last 2 weeks. And we also received 73 cases of test kits from the state. So you'll see them outside here. Jill's going to take about 40 cases and give them out to the schools because people have been asking for them. That outbreak location, they received a bunch of test kits as well.
The outbreak location, what other than students, where was it?
It was at a center.
Mm-hmm. Okay.
Yeah. Yeah. And again, Stan's mentioned the clinics. They're going to run on Wednesdays. 9/20 is going to be the first clinic. They're going to run every Wednesday for 4 weeks, and then we'll reassess there. Unfortunately, we don't have high dose. It hasn't come in yet, and that's where our seniors like to get. But once we get a high dose, we plan on having a clinic at the senior center.
Are we seeing any flu in town yet?
I haven't seen anything in CT eds where we get notifications, but to be honest, I haven't looked for it. Really.
Anything?
Yeah,
oh, sorry, Sam, go ahead.
No, I haven't seen anything in there either, so it's, and I haven't heard any announcements from the state of any, activity being seen. It's still a little early for most seasons, yeah. You guys, you really have the finger on the pulse, more than us sometimes,
Yeah, that's why I was curious, because, up in my locale, I haven't seen anything yet, but sometimes you get these little pockets that kind of scatter here and there, so just curious.
Yeah.
Let's ask you about the QPR. Any plans to introduce that into like the high schools and?
Yeah, we definitely plan on delivering it. Right now, it's a little bit hard because I'm doing it with Julie McCullough, who's our public health nurse, and we're kind of knee deep in planning flu and COVID clinics. But yeah, they do have a version for youth. And so we've definitely talked about doing that. I know Fairfield Cares, Kathy Haslett is also QPR trained, and she's done a lot. So just really kind of connecting with her and, seeing what's the next, course of action. We will be training all of the school nurses in QPR on election day. So Jill asked us to come and, train them for their professional development.
That's great.
Mm-hmm. And I think that's all I got.
Okay, is that everything, Santina?
That is, yep.
Okay, thank you so much. So are there any communications?
I have none.
How about any old business?
We have no old business on the agenda.
Okay, and any new business coming up?
Not at this point. Probably next month we're going to bring forward some additional changes to the Fairfield Public Health Code related to the changes that we made last spring regarding basement dwellings and basement unit requirements and deferring to the building and fire codes. We'll bring some new business next month. We found a couple other sections that probably needed to be edited and updated as well related to that. But that'll be next month.
Okay, that sounds great. Anybody else have any other comments or questions, anything?
No?
No.
So I guess, are we ready to adjourn?
Sure. I make a motion to adjourn.
Sure.
Okay, second. All in favor?
Second?
Lee?
Okay,
Aye.
very good.
All right.
Just a quick,
Thanks, everybody.
yeah, thanks. Hey, Sam, am I expiring in November?
I believe you are.
You know what
I
I
believe
mean.
your term is ending. I hope you're not expiring.
Oh, my term. I'm just making it up. So do do I still attend October and then that would be my last one?
The October and November would be the two last ones that you would have. You would end your, how they put it, you're welcome to attend until they appoint a new person. If you so choose to, you're still an official member of the board until they appoint someone to replace you. So you could attend for an additional few months if you wish, but, they will, the selectman's office will be notifying you, but again, I think this is the end of your second term, that'll be coming up. So you would have to take at least a year off. I know you're eager to get back on as soon as you're eligible, but I think Henry is waiting in the wings. Henry Yoon.
Oh, he is? Oh, he's going to take my spot. Okay. All right, thanks for that.
Every year there's a new spot, so.
All right, sounds good. Hope everybody has a good night.
Thanks, you too.
All right, everyone. Have a great night.
Thank you.
Thanks, everyone.
Bye.
All right, bye-bye.